Hi, I'm talking today to Stephen Brown. Stephen is a certified Rolfer. Hi, Stephen, how are you?
Hi, nice to meet you.
Nice to meet you too. Stephen, today we're talking about Rolfing. What is Rolfing? And can you tell me a little bit about the history behind it?
Okay, well, that's an excellent question. Rolfing is, well, it can be described as manual medicine. It's manipulation of the soft tissue of the body, called fascia, but it doesn't end there. It includes manipulation of bones and nerves. But Rolfing actually starts with a simple observation and then a question. The observation is that we function in the field of gravity. And it may not be something that's obvious to us, but just lift up something heavy and try to hold it out in front of you. And you'll quickly realize that we function in the field of gravity. So then the question is, how do we function in the field of gravity? Do we function the most effective way in gravity? And that is the central question of Rolfing. So the random body is often out of alignment, let's say, right? The feet and the knees and the hips should line up, particularly the pelvis and the shoulders and the head, and oftentimes they're not. So what's happening is that the body is, instead of being in alignment with gravity, the body is fighting against gravity, and eventually, guess who's going to win? So as a result, we can have a lot of aches and pains when the body is not aligned. So Rolfing seeks to organize the body around a vertical line so that rather than the body fighting against gravity, the body is supported in the field of gravity. So gravity actually is able to reinforce the body. Now, when the body is not aligned, okay, as it should be, so many complications can happen, including nerve impingements. And we're not only talking about, misalignments. I mean, misalignments also can include rotational issues as well, scoliosis and rotation of the vertebrae, rotation of the legs, which brings about hip problems, and tilts and shifts in the body. So when the body is aligned, many aches and pains go away, and it's a holistic system. One of the things that's very different about Rolfing than most other modalities is this idea of holism. And holism means that in the Rolfing process, we don't just hunt down symptoms, although if somebody comes to me with a bad back, for sure I address, particular issues, but the bad back may be coming from the person's foot, right? And if you don't address the entire body and integrate the entire body within the field of gravity, so these symptoms will quickly come back. So what my job is to not only get the person out of pain, and I would say that this happens astonishingly quickly. I often have patients that after one session, they feel very much better. In fact, I often tell people when they ask me, how many times should I come in for Rolfing? And I tell them, just come in once and you'll see how you feel. Now, because in my experience, people often feel better after one session, and certainly after 3 sessions, they feel much better. But usually I do what's called the 10 series, which covers the entire body and aligns the body. And then within that 10 series, we address, the acute aches and pains or the reasons why they came to me. Now, Rolfing is, or I should say, we Rolfers observe the body or relate to the body as one part related to another. And what we try to do is remove the blocks of energy. Remove the blocks that are impinging the energetic flow in the body. Now, that could mean neurologically as well, and how the bones are laying together. So we build something new. In a Rolfed body, there's a different relationship of parts which never existed before.
And what exactly would happen in the treatment session when I came for Rolfing?
Okay, well, the first thing I do is observe you. I observe your gait, first of all, because a human being is not a static something. A human being is a movement something. And so part of the Rolfing process is also movement education. I've developed a system of teaching people literally how to walk in ways, how to move in ways that they never thought of before. And part of that, part of Rolfing, I believe, is an educational process. And it's not just a passive, the processor on the processee of doing the manipulations, but it's also movement education. So the first thing is I observe how you're walking. Now, how we hold ourselves, right? There's a little saying, I don't remember who said it, but how a person walks across a room is how they walk through life. And so how a person's posture is, right, is very telling, not just physically, but actually psychologically as well. And when I speak about holism, I'm not only talking about how the relationships of the various body parts, but also the psychology of a person. And, we're all, everything is connected, right? Everything is connected. So there's the observation of the gait. But then I observe the person, from the front, from each side, and from the back, and see what are the patterns of the person. And that's really very much what it's all about. What are the patterns of a person, the physical and even the psychological patterns of a person? After this assessment, which becomes all important, really, a good Rolfer has to have good eyes, not just good hands, but to know what to do. What to do, it's a simple question, right? What do I do first? What do I do next, right? And then after that, they lie down on the table, and we begin the work. And I'll just give you like a very brief description of what that work looks like, right? So the session 1 typically starts with the neck, right? Actually, I always start every session with the neck and end with the back. So every session a person gets neck work and back work. Okay. And then it's the next step is the shoulder girdle, right? So a lot of people you see walking around, right, with they're hunched over, right, or one shoulder is up higher than the next because they're carrying a heavy bag, and as a result of that, the neck then goes forward, right? So again, it's how is one part related to another? So we get that shoulder girdle back and open so they can breathe better, so their heart functions better, right? And so the neck begins to, as I said before, get more on a vertical line. And the next thing we do is work on the diaphragm, which is breathing, the main muscle of respiration. But also as I work on the diaphragm, it's also affecting the internal organs, the liver, the gallbladder, the spleen, the kidneys, because as the diaphragm moves up and down, so it also moves the organs as well. So, just by working in one area, you can affect so many things. And also the main blood supply to the lower limbs runs through the stomach area, which is affected by this work, right? So it also affects blood supply and nerves. But then we get to the next step in session 1 is the pelvis. So one of the primary goals of Rolfing is to horizontalize the pelvis. Okay, there are many patterns in the pelvis, tilt and shift, and rotational issues, and this has an effect on above and below. Above and below. It by horizontalizing the pelvis, it brings about a change in the relationship to the spine and your entire body. So this is really one of the primary goals of Rolfing. Okay, and then of course some back work. Every session there's back work. So that's a session 1. A session 2 has to do with the feet and lower legs and lengthening the back. These are the primary goals. Now, everybody knows that if you build a house and you put in new doors and you put in new windows, but the foundation is shaky or the sill is warped, how long are those windows going to stay? Pretty soon they're going to be squeaking, right? So the feet are the foundation of a person's body, the feet and how the ankles are lining up, right? Are the balance of support from below. How is that? So session 2 seeks to create a foundation for the entire body. And actually each session, one of the goals is to give support for the next session. So the body will hold changes. And that's also one of the primary things that also differentiates Rolfing from many other modalities is that the changes last. The changes hold. Typically after 10 sessions, I won't need to see a person in the office for 6 months or so, maybe for a tune-up. So unlike, like I said, many other modalities where it's just a fix-it kind of a technique, when we integrate the entire structure and give it support, and so that eventually, naturally, the body becomes aligned in the field of gravity. We know how to move differently as a result. And so, we feel more energetic. We feel lighter. We feel our aches and pains have disappeared, right? So that's a session 2. Okay, session 3 is balancing the front of the body against the back, and we work along the side. And again, a primary goal here is horizontalizing the pelvis. And so many times, we revisit areas that we've worked on before because the body is built like an onion, okay, which means that we peel the layers layer by layer by layer. And as we do that, we're able to go deeper and deeper and address deeper issues and effectuate greater change. So typically after 3 sessions, people feel really different. And I could go on and on, but of what the rest of the sessions look like, but that's a good introduction. Basically it covers the entire body, and we try to work out these rotational and tilting and shifting issues, so we have then a balanced body.
Thank you, Stephen. Thank you so much for talking to me today.
Thank you very much. And I just want to tell everybody what my website is. It is israelrolfing.com. That's israelrolfing.com, and there you can find all my contact info. I'm in Jerusalem, and come on in for a session. You won't be sorry.
Thanks, Stephen. Thank you.
Thank you, Joanne.